In this video, we're going to set up your critical care worklist to help you hand over more efficiently and create lists if you need to. While your worklist is going to look very different from mine before you set it up, I'm going to first walk you through the decisions of why we put different boxes in different places. The left-hand side will always contain the patient information, and you need to have 4 or 5 rows to expose their hospital number. We'll set that up a little bit later. I'm just using some test patients here for anonymity, so not all the data is going to be pulled through. Secondly, their location. We use this for bed spaces, and you can see by the arrow here, I'm sorting by location, so that bed spaces in the lower numbers would be at the top. Then a visit. Once a patient has been admitted, this will be pulled through, telling you their date of admission and their length of stay. The next section is the key parts of information for handover: diagnoses, problems, and actions. Diagnoses are problems that a patient has presented to hospital with, their presenting complaint, as well as problems that have occurred during their hospital stay, for example, renal replacement therapy or renal failure. Problems are past medical history. These are recorded in a separate part of Cerner, and we'll discuss that in a different video. Finally, actions. This is a jobs list. It's viewable by anyone, and you can create and add actions very easily. You can then tick these off once the task is completed, making sure that the entire team is aware of what's happening for that patient. On the right hand side, I've got a selection of different headings which, while you can't see them, once they're filled in, are very helpful to see. This is RESA status, allergy status, illness severity score, again something I can change very easily to help me be aware of what's happening on the ward. Then airway. Once a patient is intubated, this will automatically be pulled through, telling you if they have an ET tube or a tracheostomy. Their isolation status, whether they have any resistant organisms that we need to be aware of. VTE, if it has been completed. And finally, a number representing the antibiotics that the patient is taking. Here, nothing has been found for this patient because it's a test patient. Now I'm going to show you how to set your critical care worklist up to look like this. Select the page menu from the top right. It's these 3 horizontal bars, and go to Layout Configuration. First thing, click on Rows and select either 4 or I would suggest 5 rows, remembering we need at least that many to be able to see the hospital number or MRN. You can then click Apply. Next, in the Columns heading, we're going to adjust our columns. You'll have to drag these around to get them into the right place. Ticking the box will allow you to select them and make them appear or disappear. As you can see, there are lots of different options here, and you can customize this to your needs, but as a start, we suggest using this as a template. Again, once you're finished, click Apply. We're going to pause here so you can see the columns on the top and which ones that you need to select. If after clicking Apply, things don't look exactly the way you expect them, remember to click Refresh in the top right, just under the name search bar. Of course, you can use your critical care worklist for lists other than the ICU list. Here you can see a selection of my list. I won't open them, but feel free to have a go yourself.